I'm intrigued though, Julie, because your background is medicine. You are a doctor, or you have been a doctor. Tell me about your journey as a doctor. I mean, how would you describe the way you practiced medicine up until that point in the pandemic?
That is a story in and of itself.
I'm intrigued by those stories, Julie, because they're transformational for many practitioners, but sadly not as many as there should be.
Yeah. And I think I've always said, one of the best educational experiences I had in medicine was being a patient myself. And I think it was that experience that really positioned me to see that some of the things that were being done as part of the pandemic response were counterintuitive and weren't really setting people up to be healthy, which has made me what made me look into it further. We've had a lot of terms bandied around in the last few years, conspiracy theorists, anti-vaxxers, misinformation, blah, blah, blah. Call it what you will, but you have to be prepared to ask questions. And when I was practicing medicine, as we entered the pandemic, I very much was practicing in a way that, I'd been forced to ask questions about the education that I had, the way that we were being trained, and that was simply because I'd actually been forced to go and find my own answers. And it started. I mean, I've always been very fit, very healthy. I've loved the outdoor lifestyle. I've, never smoked, never been overweight, love sport, love eating healthy. And so you can imagine my surprise when I developed breast cancer at the age of 39 with no family history. And what then followed was a series of unfortunate events that forced me down a path of actually looking at, well, what is health? What is real health?